General enough. It's not just the volume of positive cases, it's everything.
Just the last
Right. Well, I would say the state's numbers for, it's for a whole bunch of different things. So it's for hospitalizations. Positive tests. Healthcare worker infections.
Yeah.
And
Yeah, for sure.
and healthcare infections remain too high. Okay, I gotta go. Bye.
Yeah, that would be great. I'm getting, there's a little bit of
Hey, testing.
Thank you. So Aaron has a roaming right for the Idaho Gov industry and we've been going there. So the only question is about restate or the one that we won't be able to follow. We'll call them, we'll let these guys ask and then we'll ask everybody over to go themselves with stars.
You like the way my kids dress?
I know that. You know, you can stretch it out.
Well, look at this.
You set a new standard here.
You're a close second.
Oh, gosh, I'm very impressed. Sherry's got her matching on too.
I have not. Cause that's. The guy on the council last week said, oh, it's just a big.
Yes.
I'm trying to get closer and closer to your office.
I did that on purpose.
Hey, everything okay?
It's good.
I just tried to change.
Yeah, it's always changed. I get to sort of no. I just all you would they would okay. Congratulations. Oh, thank you.
Oh, what?
Yeah, I know where for few days.
I didn't know that. I always assumed that.
I've been in education, like, is she gonna be on my
She's not. Is somebody gonna be standing up there?
Yeah.
Where's you gonna stand? That where's you gonna stand?
How about you? Then you're good.
You know, it's different.
Is this far enough?
She will be in the shot if she was over a little bit that way.
Good.
Will you still be able to see her?
Yeah, good. That's what we all need to do.
Yeah.
Maybe 2 feet to the left. There you go. Yeah, that's perfect. Yeah.
Chris is the old man. Just turn the lights off, the lights off.
It's easier than
Hi, Kurt. This is where you.
die, that's not how I want to die. You know, I want to be around my family. I want to be able to tell them I love them.
Emily. Nice to meet you. I know.
Would you like your guests to be able to unmute their own lines by pressing *6? If yes, press 1. All guests have been muted. You will now rejoin the meeting.
This is the News at Noon.
And welcome to the News at Noon. I'm Doug Petcash. We join you now with this special report about the state of Idaho. Right now, we are waiting to hear from Idaho Governor Brad Little in a news conference that is scheduled to start in just a few minutes. This is a live view of the room where it will be happening. The governor will address the reopening of schools and where the state stands with its reopening plan. You can see a little bit of their chart there about supporting schools. We're going to take you to this news conference as soon as it begins. The governor has proven to be very prompt, so we expect it to start very near noon. Right now, most of the state is in stage 4, which puts some restrictions on businesses but does not require them to close. But Ada County is in stage 3, which requires bars and nightclubs to stay closed. Now, as far as schools opening goes, well, that gets a little more complicated. The state has left the decision on how to reopen schools or if schools will reopen to each individual school district. The biggest school district in the state, West Ada, voted this week to push back the start of its school year to September 8th. That's the day after Labor Day, although they haven't decided yet if it will be in person or online. Also this week, the Boise School District voted in a board meeting to start the school year virtually, all online. The virtual classes will begin on August 17th. And then in 3 weeks, they said they will reevaluate and make another decision. So it will be online for at least 3 weeks. The district also adds that the final add and drop date for the Boise online school is Friday at noon. That's tomorrow at noon. And this just into our newsroom within the last hour. Boise Parks and Rec is now partnering with the Boise School District to offer childcare programs at 5 school-based community centers this fall. The Kid City camps will be offered Monday through Friday for kids going into 1st through 6th grades when in-person school is canceled. Registration opens on Monday, but capacity is limited to 24 kids per camp. There are 5 camps. The locations are on your screen right now. The camps cost $80 per week per child if you are a Boise resident. Non-residents will be charged $123 per week per child. Well, now for the latest coronavirus numbers in our state. Yesterday, there were 409 new confirmed and 72 probable cases reported. This brings the statewide total to nearly 23,000. After reporting the lowest hospitalizations in a month on Saturday, Idaho reached a record number of hospitalizations just 2 days later. Also, 3 new deaths were reported yesterday, bringing the total to 218. One of the 3 deaths was from Gem County, the first for that area. The state also reports that more than 8,000 people have now recovered from COVID-19 illness. As schools and parents work to make plans for the school year, we've heard researchers say that kids don't get the virus as easily because they haven't been showing severe symptoms. But now we're learning that may not be the case. New studies are saying that kids may be more efficient in spreading COVID-19 than adults are. They just don't get as sick. We talked to St. Luke's emergency room physician and medical director for St. Luke's Children's Hospital, Dr. Kenny Bramwell, yesterday. He agrees with the most recent findings.
Children seem to transmit it quite effectively, just like they do other viruses. The difference with the children that we have seen both locally and nationally is that they don't seem to get as sick from this illness, and they don't need to be hospitalized anywhere near as commonly. But they certainly seem to get it, and they seem to be really efficient asymptomatic spreaders. We think that they're, first of all, exposed to many more germs and illnesses than the rest of us, and they don't always wash their hands particularly well. And they have also a very different concept of personal space. You watch kindergartners line up and interact with each other. They are talking to each other, they're hugging each other, they're doing stuff that we typically don't do as adults.
And on a personal note, Dr. Bremmel added that he plans to send his 16-year-old to school, but each family should evaluate their specific risks before deciding to send their kids to school for in-person learning, if that is an option in your school district. Now, the Ada County Jail has confirmed 68 inmates have tested positive for COVID-19. All inmates were then given masks. All staff are screened before they enter the building and required to wear masks with limited exceptions. As of yesterday, 6 employees have tested positive. 4 of them already recovered and came back to work. Now to the latest unemployment numbers just into our newsroom this afternoon. Initial claims in our state are actually down 23%. We're going to go to the news conference now. Governor Brad Little has taken the podium.
Public health districts to finalize their plans for a safe reopening of schools. 1 month ago, we stood here, well, actually over there, to roll out Idaho's official framework to guide local school officials as they assemble their plans. We also stood here to reinforce the expectation that students must return to school for in-person instruction as much as possible. School operations will not look the same across the state based on virus activity and healthcare capacity in specific communities. However, when students are out of the classroom for too long, the achievement gap widens. This gap draws down the progress of all students. This gap is detrimental to economic prosperity and future workforce demands. This gap inhibits an educated populace, which is critical to a successful democratic republic. Despite the incredible advances in digital learning, we can't even run this thing, you can never replace the value and impact of in-person interaction with professional, dedicated teachers. The expectation is that schools will not be closed for extended periods of time during the 2021 academic year. I genuinely understand the deep concern of some teachers and parents about returning to school for in-person instruction. That is why we have put significant resources into the safe reopening of schools. We've put $10 million towards additional masks, gloves, sanitizers, and plexiglass for Idaho schools. $48 million will help bridge the digital divide. Blended learning will be a reality for many Idaho students. And we're equipping schools with computers, connectivity, and other resources to ensure successful remote learning. We put $21 million towards COVID-19 testing for teachers and staff. Our testing task force identified these critical workers as a priority group, and the task force is nearing completion on its recommendation for testing staff and students. The $3 million we put toward increasing testing lab turnaround time and capacity, as well as lab upgrades, will help us to get test results for teachers and school staff as quickly as possible. An additional $3 million will leverage Idaho's pharmacies and testing efforts to help us quickly produce testing results for teachers and school staff and families in rural Idaho, where the majority of Idaho school districts are located. All these steps are helping to make schools safe places to teach and learn. The unprecedented amount of money we are pumping into our schools for safety should provide teachers and parents with the confidence to return to the classroom for in-person instruction. At the state level, we remain engaged with local school leaders across the state, and we're watching closely why those school districts and charter schools develop and refine their reopening plans. Meanwhile, bolstering public schools financially continues to be our focus. While Idaho state government, all of Idaho state government is facing 5% cuts this year, far better than the 20 to 40% reductions that are taking place in other states, Idaho public schools will be minimally impacted by revenue shortfalls. Fiscal conservatism elsewhere in state government, combined with the relief funds we directed to K-12, means teachers, students, and parents won't feel as much an impact in schools here as they will in other states. We are in a much different place now than we were in March. Our economy is open. Our parents have returned to their places of work. We have increased our capacity for testing, contact tracing, PPE, and other healthcare capacity to make it more adequate. Of course, in the more populated areas of Idaho, Ada, Canyon, Kootenai, Bonneville, and Twin Falls counties, in particular, virus activity is straining our local healthcare system. On the other hand, we have half our counties with a current case rate of less than 11 cases per 100,000 residents. Our shift to a more localized response to COVID-19 is the right approach. Where the public health district boards have done the right thing to address outbreaks by implementing appropriate mitigation measures, we are seeing positive results. Today, I'm announcing that statewide, Idaho will remain in stage 4 for another 2 weeks. Over the last month, you have heard us talk about adding new information to our metrics review process to better capture the impacts on our healthcare system in Idaho. In addition to all the other statewide metrics we've been examining every 2 weeks, we will now also review overall hospital admissions. This is information we didn't have access to previously, and the White House suggested we use it in our decision-making progress. Even though we will remain in stage 4 statewide for another 2 weeks, our statewide metrics are looking better. We have sufficient healthcare workers, PPE, ventilators, and ICU beds. We are meeting the demands for testing our healthcare workers. We are seeing downward trend in overall case counts as well as our percent positivity rates. Emergency room visits for those with COVID-like symptoms are on the decline. To my reporter friends, I ask that you cover these points. What I frequently read on your posts is just the daily case counts, especially in the areas of the most spread. Clearly, our decision-making is based on more than just daily case numbers. We do need to bring down the number of hospital admissions statewide. But even in some of the hot spots, we are starting to see the benefit of measures that local health officials and mayors have implemented to reduce the rate of spread and preserve hospital capacity. That tells me our efforts are working. Thank you, Idahoans, for wearing a mask in public, keeping physical distances from others, maintaining good hygiene and clean spaces, and for staying home if you're sick. If we continue to practice these measures, we will be able to send our kids back to school. We will be able to keep our citizens safe and continue to rebound our economy and restore jobs. With that, Dr. Hahn will review our statewide metrics, and then we'll have a few words from State Board of Education President Debbie Critchfield, and Superintendent Ibarra will speak. And then Emmett School District Superintendent Craig Woods will share his thoughts on the reopening. He's got a very important job because my sometimes precious grandchildren attend the public school in his district. After that, we'll take your question. Debbie? Oh, Dr. Hahn, I'm sorry. I jumped ahead.
You jumped ahead. That's all right. I'll be quick, 'cause I know we want to hear from Debbie. So, can you guys hear me okay? All right. Yeah, it does sound okay. I'll try to speak up a little bit. So I know it's a little bit hard to see. Of course, this will all be on our website, and this will all be, I think there might be handouts available as well. But I'll just quickly go through our metrics and really focus on the new metric that the governor mentioned. So we look at these 3 areas every time. One is basically how widespread is this virus, what's happening. Secondly, how many people are getting severely sick. And then thirdly, how is our healthcare capacity doing to handle this? So looking at just the number of cases and the percent of positive tests, which tell us basically how widespread is this occurring, how many people are getting infected, we are seeing a downward trend. We know that that is from a high number. We're not where we need to be. But as the governor alluded to, things are coming down, and we're hopeful that part of this is because of the action of people it's so nice to look out at a sea of masks and smiling eyes, I should say, of people. I think that we are seeing better use across the state of masks. I think we're starting to see some benefits from that. Next slide. Are you doing? Thank you. I feel like we skipped something, but maybe not. Okay. Okay. Yes. Thank you. Our syndromic data. However, our emergency department data is also suggesting fewer people coming in through the emergency department. This is one of our reflections on how many people are getting sick enough to show up in an emergency department, and even more importantly, how many people are getting admitted. Again, we're coming down from a very high number, so although this is reassuring, we recognize that we still have quite a burden of illness and quite a number of people ill in our state, which takes me to our third measure, which we have added to this time. I mentioned this a month ago. I mentioned it again 2 weeks ago. We would have liked to have made this change a month ago, but as you may recall, the federal government switched the system for hospitals to report, and so we had a little bit of a glitch there, just making sure we had the new system working correctly and hospitals able to input data. So we've held off on this. But real quickly, this you've seen before. We have plenty of intensive care units and intensive care unit beds and ventilators, and so we're happy to see that. We also have a sufficient supply of PPE right now, according to the hospitals, that they have a 10-day supply at least on hand. Next slide. This you've seen as well, and this is our number of healthcare workers being reported with infections. I will say that this is a measure that we are looking at, and we are going to probably tweak this over time. We think that this is dependent on the local health departments to be able to interview and get that information to us, and we are worried about delays in that information sometimes. So expect this one to change next time. Nonetheless, it's gratifying to see that we aren't seeing a rise. We aren't seeing a large number of healthcare workers getting infected. Next slide. So this is the new, includes some new information. So the top one has already been there, which is crisis standards of care. We've talked about this is when the hospitals may actually have to use special measures because they don't have enough of something. They don't have enough beds. They don't have enough medication. They don't have enough ventilators. Thankfully, we've not had to implement that in Idaho. You may be aware that Arizona did need to implement that a few weeks ago. So that's something that we keep an eye on. We are not there yet, so that's very good. However, in this measure, we've added this measure at the bottom now, which is the number of people being admitted daily to the hospital for confirmed COVID disease in Idaho. We'd like to see that number below 4, and we are actually, on average, we're saying below 4 per day, and as you can see, we are well above that, even over up to 14 a few days ago. So that is a measure that we think is extremely important. We would have added this sooner if we had had the information, but we think it's a really, really important measure. We've heard from our hospitals that they are starting to see more and more patients. You can go on our website and see the number of patients in the hospital is continuing to creep up. We really need to take that measure seriously, and that's why we do not pass out of stage 4 for this time. So that's all I'm going to.
Thank you, Doctor. Next, the state board president, Debbie Critchfield. Debbie and I were just over with the superintendents, and they are very thankful for the work that the state board has done. Kirk Liebeck is in the back. Kirk's leading the committee we have on the digital divide, which you're all aware of, but the state board has had to do a lot of overtime this summer to address a lot of the differences in our school districts about going back to school. So, Chairman Critchfield.
Good afternoon. I appreciate the opportunity to report out since we initially published and put out our state board back to school guidelines. As you can imagine, we've had a number of phone calls and a number of emails. And I know personally, and I'm sure Kirk would agree with this, that I don't go anywhere that someone doesn't approach me and ask me what school is going to look like. And the answer to that is very specific, and it depends on where you are in the state and the actions and plans and course that the local board has chosen to take. Like the governor, we have the same priority, we as in the State Board of Education, of getting students connected with their teachers in the most practical and safe way possible. There is an expectation that learning will take place, and the expectation includes a higher level of support for students and for staff than what we saw in the spring leading up to the soft closure. I want to highlight something that has been of note in the last week or so as districts have met to talk about their plans and what those will look like, the differences. That has been highlighted quite a bit, and I want to communicate that as a board, we are very comfortable with and had expected that the plans would look differently. That's exactly what the guidelines were designed to do. And so as there's discussion from school district to school district and in the differences that we have around the state, we are not surprised by that. We fully intended that that would be part of the process, and we are satisfied to see that that's taking place, because that means that local boards are doing exactly what we hoped they would do, making determinations based on their own capacity, their own resources, and their own needs and expectations of the community and of their students. Something that we are not comfortable with is looking at this in a linear way where there's only A or B. We're either open or we're closed. There is a lot of room between those 2 points. And we are here to support and want to publicly advocate that districts continue to have those discussions. Everything about the guidelines also invited collaboration. We want districts to seek out the experts in their area, and it is not limited to their local public health, to their hospital leaders, to their business leaders, parents, daycare providers. And as they make those decisions, they have all of the factors that they need to ensure that students get the education in the best way possible. Our hope is that it can be in person in some form or another for some period of time, but we are certainly not suggesting or promoting that public safety be tossed aside for that end. But we don't believe that it needs to be. These are not exclusive ideals of being safe and also having some form of in-person learning. Within these individual plans and individual responses, we also expect that there will be specific responses within that. There may be subgroups. If you're not able to deliver a completely or totally online experience, could your career technical students have an opportunity to do that as they're spaced out in a lab? What about students with special needs? So even within the context of a local district, there are still specific responses and appropriate responses that would help support students. I believe in the strength of our communities. I believe in the power of collaboration for solving these complex issues. And when we add the needed leadership at the local school district level, we are positioned to meet the needs of our students for the coming year. And on behalf of the Board of Education and the Governor, I appreciate the opportunity to express that goal and to help advocate for our students. Thank you.
Thanks, Debbie. And of course, another member of the state board and also a constitutional officer who's had, like everyone, a significantly increased workload given the tumultuous times for education, Superintendent Ibarra. Sherry.
Good afternoon, and thank you, Governor. Early August is typically the time of great excitement. Those of us in education especially know that. We are busy getting our classrooms and playgrounds ready, and parents are busy shopping for school supplies and picking out school clothes for their students. But this year, because of COVID, it has been a tense time for everyone, and education is not immune. For many reasons, we want our schools to reopen, and for some kids, it's because they're losing ground fast. For other students, it's their social-emotional well-being that's suffering, and for some kids, unfortunately, school is the only place where a nutritious meal will be served for the day. As you can see from these examples, it's obvious that reopening schools in person, as soon as it is safe to do so, is a top priority for all of us, as you heard here today. However, the safety of students and staff must remain paramount, and the data must inform every decision that's made at the state and the local level. Because of the rapidly changing conditions with this virus, there's no one-size-fits-all that will be a template for our schools. Every community is and will be different. I've had the honor to spend a lot of time with many of our new school superintendents as well as our veteran administrators this week, and I can tell you on their behalf, they are working extremely hard, making some really hard decisions and planning for multiple situations for this school year and for going beyond that, whatever happens in their communities. I know that they are listening to parents, to students, to teachers, and patrons as they make these important decisions. I want to take a moment to thank the governor and his Digital Divide Task Force for focusing on how to ensure that all students have the necessary resources as we begin to reopen, such as computer devices and internet connectivity, learning management systems, and teacher training, when and if online instruction is mandated by the local conditions. So much has been done in just a few short weeks, and our districts are doing all they can to be ready in the event that they have to pivot to online learning at a moment's notice. But we know that computers and websites, apps and videos cannot replace the in-person experience for schools and our students. We know that it's the teacher in the classroom that has the biggest impact on student learning. Like all of us here today, I understand and share the concerns of teachers and parents about returning to school for in-person instruction. You've heard a lot from others before me about the plans that everybody has taken a lot of time and thought into. This is a scary time, I get that, but we are being responsible and making personal protective equipment available to our schools. I want to thank the Office of Emergency Management for working with me all through the summer to get barrels and gallons of free hand sanitizer and face masks out to our school districts. In fact, this morning I was at the annual School Superintendent's Conference handing out more face masks and digital thermometers so that every school has one. And thank you, Governor Little, for the additional $10 million for additional supplies and PPE for our schools. This pandemic and the reopening of schools must coexist because of the short and long-term consequences for kids that I mentioned earlier. When our schools have to close, our kids suffer. And as citizens of this great state, we must work together to show our commitment of getting this pandemic under control so that students can return safely as soon as possible. We all know the seriousness of the issues that we're facing right now, but I have trust and confidence in our educators. They will face this test of leadership and determination to ensure that all of Idaho students get the education they need and deserve. And as your superintendent, but most importantly, as a parent myself, I will constantly do my part and remind my child, who is now 20, wash your hands, wear your face mask, and yes, he still asks the age-old question of why, because it's a small sacrifice to make for those around us. And please, social distance. Thank you.
And one of those hard-working superintendents that the superintendent just alluded to is Craig from Emmett.
Well, I'd just like to thank you for the opportunity. I've got a lot of pressure on me because I do have his grandkids within our school district, so we're the one district I know we got to get it right, or I'm going to have him coming by the house and saying some things. But I do want to thank the governor and the State Board of Education and especially the State Department of Ed for their support. They've been amazing through this time. When we've asked for things, they've given it to us. You know, when especially the flexibility with some of our waivers at the State Department. And so, I think we all have the same goal in mind, is to put our students back in the classroom. And our reopening plan in Emmett is different than what you're going to see in the Treasure Valley. But it's something that not only our administration, our staff members, and our public put together. So we put this thing together for our students, and we looked at 3 priorities. provide a safe and healthy environment for our students and our staff, get face-to-face instruction back that's safe. And then the third thing was to have an option if that's not what the parents want. And so we've tried to do that. I agree with just about everything that Governor Little and President Crisfield talked about. I will say that through this whole thing, the collaboration piece has been amazing. I know more about the State Board of Ed and the workings of it through the Zoom meetings that we've listened to. And the superintendents in this Treasure Valley and across the state have come together, and we've talked to one another. And so we've created powerful reopening plans, and they're all different. Every one of them are different, and we're going to have to adjust because, again, the only constant in this thing is that it's going to change. And we've told our board members that you're going to see change. As more data comes out of where we're at, we will continue to change. And I just, last little thing I'd like to say is, again, we have to move forward. And what is our vision? And our vision is to provide education for our students. And I just want to thank you for the opportunity. So.
Okay. Have we got this thing fixed, Mackenzie?
I think so.
Good.
If you're on the phone, you can unmute your line to ask a question by pressing *6.
Governor, CBS 2's Brian Warren is asking, how close are we to moving out of stage 4? Are we close? What's it going to take to get there? Or is Ada County, Canyon County, and these that are a little more of the hot spots and they're in 3, are they holding us back? Can you talk about that?
As I said earlier, even if we get out of stage 4, there's going to be guidance and there's going to be directions and there's going to be there's going to be different aspects. So when we first started looking at these numbers a couple days ago, there were some a lot of those lines are headed down, but we're still worried about this gap between the red line. You notice that Director Jepson and I have a new visual aid, which more reflects where we are now. And anytime we get close, that blue bubble gets next to that red line, whether it be regionally or statewide, we'll be concerned. So we could get out of stage 4, but we're still going to have different areas of the state that are going to have different, and particularly when we get, here's some of the outliers there. Kids being back in school, the start of the flu season, our ICU capacity was built for the flu season. So if we have an abnormal flu season, that will change the delta between the blue bubble and the red line. Clark.
Yeah, hey Governor, I've got a couple of questions from the folks back at Idaho Education News. I'll ask mine first and then maybe a follow-up. But I'm aware of the work that the Digital Divide Committee did this summer. I'm aware of how the CARES Act funding is being distributed and the extra money and so forth. At the same time, could the state or should the state have done more to prepare for remote learning or online learning or blended learning, because 2 of the top 3 school districts are starting that way, and the largest school district in the state does not have the computers they need for children. So should there have been more an emphasis on remote learning or digital learning?
Well, I keep making eye contact with Kirk back there because that's a question that I asked. If I remember the numbers, and you can give me a head fake, over the last 6 years we put $136 million into. He gave me the thumbs up, and some school districts, even some of the school districts that don't have as big a tax base, have already gone to 1-to-1. We have encouraged them. It's been the intent of the department and the state board that they did that. Nobody saw this pandemic coming, but some of those school districts are ahead of others, and that is part of the trade-off between local control and how you put that money out. There's the state's doing money. We're taking some of our CARES money. Private industry is making efforts, but it's a fact of life that some of these districts were better prepared for the necessity than other districts, and that's just the way we fund and operate education in Idaho. But we're going to have to accelerate it up going forward. But
Accelerate what up?
What we do, and believe me, I don't know that any of the districts that didn't get to 1-to-1, didn't do more training for their teachers, wish they had done more. And this just accelerates that. When this is all said and done, our ability to deliver both part online and part in-person education is going to be a lot better. But as I said in my prepared remarks, I'm very concerned that the gap that exists between the haves and the have-nots is going to get bigger, and that's why there's all these efforts at this point in time.
Okay, thanks for that, Governor. And real quick, Kevin Richard had a question. Yesterday, you announced that you're going to call a special session of the Idaho legislature.
Oh, I did? Oh, okay. I missed that one.
Anyways, are you going to be, will the legislature be addressing the coronavirus pandemic, or how will you set the parameters for the subjects or RSs that the legislature will address during the special session?
Well, even before our announcement yesterday, I had said multiple times, sometimes from this podium over there, that if there was, in compliance with the Idaho Constitution, if there was an agreement on both sides of the legislature, and the pro tem and the speaker put out criterias, and they put together kind of interim working committees on what that issue was, and in the last 20 years, it's been on one issue. Probably the broadest one in my lifetime was when Governor Andrews called a special session on the broad issue of Indian gaming. But the language in our Constitution is that the legislature comes to town for a specific issue, and so the one that we do know is liability, addressing liability for both education and for business, and it looks like there's a consensus on elections. Both of those I talked about. There's a lot of talk about education, but the consensus part is maybe a little, they're not quite there yet.
Thanks, Governor.
Yeah.
Governor, CBS 2 Scott Logan is asking more questions about the special session. Why call it now? Were there deadlines to meet?
Well, we got an election coming up, and we've got school starting. The people where Craig and Debbie and Sherry are their patrons, their teachers are asking that question. So that's the timeliness right now.
Have there been discussions with the Senate leadership and the House leadership regarding safety, wearing masks, those kind of things, meeting together or remotely? How are we going to do this?
Yes, there have been discussions, but it's the legislature. They have jurisdiction over the 3 floors in the Capitol. That's their right. They've had lots of discussions. In fact, our CFAC committee appropriated $1.1 million, I think, in additional money for technology for them to do more remote delivery, more remote testimony. So it's been top of mind.
So as I understand it, that won't be ready until October. So what are you going to do for this session?
Well, there's some things that have been, everybody knows that your ability, because the legislature's been working with this for years, your ability to dial in from the far reaches of Idaho to a hearing and make that available, we've got vastly better access by the public to the legislative process that we've had before. But the virus, the transmissible moments that exist over there are going to have to be addressed. How do they do a roll call? How do they do the spacing? What do you change a House and Senate floor? And I'm just spitballing here, where it's like a grocery store where there's one door where you come in and one door where you go out. Those are all things, and they're aware of it. They'll get it.
Governor, on the same topic, is there concern about having 50, 100 people in that building where you have 2 existing health orders, one in the city of Boise, one specifically in Ada County, asking there not to be more than 50 people together at the same time, in addition to the mask orders?
Obviously, it's a concern, but I was just over at the superintendent's meeting, and the Grove, I think it was their first event they'd had in a long time. The rooms were spaced out way more than they are in here. Matter of fact, this is probably a bigger risk than they're going to have there. So you guys all got to get out of here. We're learning as the science evolves. We're learning how to do this, and if they do the right thing, they should be okay. If everybody does the right thing.
Will you be asking legislators to wear masks in the Capitol?
the line between who establishes the rules is pretty plain in Idaho. The courts determine their rules, the legislative branch determines their rules. I think it's good practice. I don't dare stand here and not say it's good practice with Dr. Hahn looking over my shoulder.
But would you advise them to wear them?
Absolutely.
Governor Melissa Davlin's on the phone.
Hi, Melissa. Speak up.
I just heard her.
I'm not sure if that was Melissa
Nope.
Dadlin. This is Ruth Brown with the Idaho Statesman.
Hi, Ruth. Go ahead, Ruth. Go ahead.
Hi. The reason I was going to shift back to something you said earlier. You talked about the shift of leaving decisions to local health districts and local control. I wanted to talk to you a little bit about. So, as you likely know, some of the board members on those boards of health have expressed, disbelief about COVID-19. Some of them have flat out said they don't believe that COVID-19 is an urgent problem. Meanwhile, you have, of course, repeatedly acknowledged that this virus is indeed a problem and needs to be taken seriously. Do you have concern about some of the decisions being left to the local district when there is a very real possibility that some of these boards may not mandate anything? So I guess how confident are you that these boards of health will take action if action is needed?
Well, I think I know I've said at this podium, never say never, never say always. But that's, for 50 years, that's been how we've administered public health in the state of Idaho. And I stole it from somebody, but I can't remember who. The key part of public health is public. And those, for the most part, 80% of all the members of the health districts, I'll see if Elke will give me a head nod if that's correct, 80% of them are elected. They're county commissioners, they're all required to have one medical person on their board, but they're selected by the rest of them. But they represent the public, just like the legislative branch and the county commissioners represent the public. So I am fully committed to do all I can to give them all the tools, the resources, the advice, and the counsel for them to look at the data that we have and make the right decision. And we actually have 1, 2, 3 health districts that have mandates. Yeah, 3 health districts out of the 7 that have mandates, and the remainder 4 have also got strong suggestions and advice out there. So we're getting there. We've got a couple areas where I'd like to get there a little faster. Keith?
Are you aware of any Idaho state lawmakers who have contracted COVID-19?
Any Idaho lawmakers that have contracted COVID-19? No, I know one of my, or 2 of my fellow governors that have, but I don't know of any of the legislators. Betsy?
Governor, how important is it to you that the state move out of stage 4? What difference would it make?
Well, as I've stated, even if we move out of stage 4, there'll still be directions, there'll still be counsel, there'll still be advice, there'll still be local public boards of health recommendations. It's not the end of the world if we don't get out of stage 4, but to me it's the message that we are out of stage 4 because we've done the right thing. We've met these gating criteria that are out there. So some of it is goal oriented, but some of it is just the message that we've got people doing the right thing, and therefore our incident rate is down. I am concerned, as I stated earlier, about what happens when the flu season starts up. About, does this line come down and having nothing to do, this is our healthcare capacity with COVID, but because of traditional seasonal capacity in our hospitals needed. So we may be out of stage 4, but the delta between the incidence rate and the healthcare capacity may get tighter, having nothing to do with stage 4.
Governor, you mentioned messaging. Your President of the State Board of Education just said here at that podium, quote, "Our hope is that it can be in person in some form or another for some period of time." Whereas just a few minutes before that, you said, quote, "The expectation is that schools will not be closed for extended periods of time during the 2021 academic year." Are you on the same page?
Absolutely, absolutely.
So if the situation required in various districts that schools be closed for an extended period of time, would you try to block that, or what?
No, but, and I didn't say it at this event, but I know I've said it at other ones. Last spring in March, when we had the big outbreak, and we didn't have PPE, we didn't have healthcare capacity, we didn't have treatments, we didn't have all these things in this. We hadn't changed the rules to have more healthcare workers. When we had the run in Blaine County, I was all in on shutting schools in Blaine County. Now, the record will reflect, and these two board members know, a lot of the decision to shut schools down last year was the actions of the trustees, the boards, the superintendents. We know a lot more, and these guys have done an incredible amount of work with the school districts since then. If we are in risk of not having healthcare capacity, they will, those schools will have to modify it. But the expectation, the default, is we want kids in school. There's going to be circumstances where they're not, but the default situation is kids in school. How'd I do, Debbie?
Perfect.
Thanks. Yes.
Nicole Carter with Idaho News 6. You keep talking about our readiness with, how many ventilators we have, beds we have. What about healthcare staff? They're still at risk of getting sick. Could you kind of?
Well, I'll let Dr. Hahn address it, but that was our ability to measure it, and the timeliness of our ability to measurement is that's why for the last 4 weeks, we've kind of rolled out. We don't think we've got as good of timely of information on healthcare workers, because people show up. Basically, you get a test. First thing we do is notify their healthcare worker, and then it goes to the health district and they do the tracing. If they find out they're a healthcare worker, well, the gap that exists between the time we know that and the time we want to know it is too long, and I'll let Chris talk about it more.
Yeah, I think the governor got that exactly right. We've been talking about that, and I mentioned it during my presentation. As the governor mentioned, our data on how many healthcare workers are reported to us, there's those delays with making sure the health department has had time to interview that person. Oh, you're a nurse. Oh, better put that. So now, with the changes in the federal reporting system, hospitals are reporting directly in now to that federal system every day if they're concerned about staff shortages either that day or within the next week. So that's what we're hoping to tweak for next time. We're still looking at that data, making sure we're comfortable with it. It's also new, but absolutely right. We've heard that from the hospitals over and over. It's not about beds. It's about, you need people to staff the beds, and so with staffing shortages, we don't really have a fully functional system.
And I would add on to what Dr. Hahn said. Going back to schools is part of this. The healthcare workers, if they are having trouble finding childcare and their kids aren't in school, when this first started happening last spring, Director Jepson and we met with the hospitals. That was a critical issue to them. Was my critical care nurses, my doctors can't show up if they're worried about health care or daycare for their children. Yes, Jacob.
With all the money that's going towards schools,
Just a moment. You'll be next.
is there any specific plans to give more money to programs that feed children? To expand any of those options to parents? Is there anything like that in the works?
Well, there's actually there are several programs that have been going on. The story last week, which I was surprised when I saw it, that was a timing issue about we're going to make the application. I'll let because that was top of mind. We got the question on the AARP call. Dave and I did, and I'll let him because he understands it fully. Part of it was we had to get the data through the State Department of Education from the school districts, and because they're the ones that have the data, and there's a lot been going on. We do know that in some of the other states where they just kind of categorically put a request out there that they're being looked at to be audited by the federal government, we're going to have this right when we submit the claim. So there is a program. Dave, do you want to talk any more about that?
So to the question of ensuring that we ensure that those folks that have need for food have access to that, there's quite a bit that's gone on in the state. And just picking up where the governor left off, there's the pandemic EBT program that's meant for those kids that are on free or reduced lunch. That application has been submitted this week for Idaho, and we anticipate that to be approved quickly and move forward with that. But I do want to emphasize there are many, many programs that have been in place since the beginning of the pandemic to help families that are food insecure or in need of food. One of those is that for supplemental nutritional SNAP, I forget what it's food stamps is what it's often called, that is generally been done. It's a federal program. It's generally done on income and sloped on income. Throughout the pandemic, that federal program is paid out at the max amount for any family that qualifies for SNAP. In addition, there's been additional funds both from the Fed level through the CARES Act into the temporary emergency food program. We've been pushing that money out for infrastructure as well as food directly with the food bank and other services that provide foods to families. And I'm not as qualified to speak about this, but I do know that schools, even though the kids were not in schools, many of them continued to offer lunch options or food options to their students. That as the superintendent mentioned, that's their only option was at school to get that nutritious meal. And the list goes on. So we have really been focused on making sure that for those with food insecurity or those that may have lost their job, that they had access to that basic necessity.
Okay, caller.
Hi, Governor Little. Melissa Davlin with Idaho Public Television. You've spoken a lot about schools that are going to be able to reopen, but there are a lot of us families who are living here in red zones with a lot of uncontrolled community spread, and our districts have decided to do things like blended learning models. And I have talked to so many families that are just frantic trying to figure out their work schedules, talking about going part-time or even having one of the families or one of the parents quit in anticipation for having to do this for a few months. So is there anything that's on the table immediately for this special session or among your committees that would ease this economic burden that's disproportionately falling on women?
Well, the question is, and I think we hear better on the speakerphone than we do around the room, but you know, this is I think both Sherry and Debbie and Craig all talked about how it's going to be different in different areas. Believe me, I can't make a guarantee about what's going to happen, other than I can tell you if you do the things that we all ask you to do, it's going to be easier for everybody. One of the things in the two big school districts, and there are 158 other districts in the state besides the two here for your statewide audience, we know that there should be, our numbers should continue to get better because of some of the things that Central District Health have done here. And we haven't quite seen the results of that. So I'm optimistic that the standard here, and both those school districts push the date, are looking at pushing the date back. And I think that's probably the prudent thing to do. We are concerned, and I just talked to some of the superintendents down the street a little bit ago. Some of them, their first day of school is 14 days after a big rodeo fair, big event, and they're interested in what's going to happen there. But the activity that takes place today is going to reflect in what our numbers are in roughly 2 weeks.
James Dawson from Boise State Public Radio.
James, just a second.
State legislature. Sorry,
Go ahead, James. You're next, Joey. Go ahead.
Yeah, you and the state legislature have made teacher retention a priority over the past few years with higher salaries, among other things. But what do you say to teachers who now have to choose between their job and their health, especially if lawmakers pass liability limitations during the special session? And are you worried that that and the push back into physical classrooms could lead to fewer teachers moving to or staying in Idaho?
Yes, I am nervous about it. But we want to retain teachers. I would tell you that anecdotally, when I talk to other governors, there are not going to be big pay increases in any of the states around us. We continue to try and change the differentiation between teacher pay in Idaho and teacher pay in particularly our surrounding states. But the risk is everywhere. If it's just like anything in life, if it is stressful and you're on the verge of retirement, you may retire early. Matter of fact, I just ran into one of the administrators over at the superintendent's, who's a very, very dear friend of mine, has been all her life, and she said, I was thinking about retiring last year. I didn't. I'll make it through this, but it's going to be tough. But it's tough for everybody. It's tough for people in the media, I've even heard, to work in the time of a pandemic. It's tough for governors. It's tough for a lot of people. But for me, the critical issue is the balance between what do we do about these kids in the gap that are going to get further behind versus the safety issue. It's not a one-to-one issue, and that's why we're doing all this work we can to keep people safe. If you're immune compromised, if you've got health issues, that's a whole different issue. But if the district's doing the right thing, if our positivity numbers are going the right direction, I believe we can be back in school. But I'm not denying that life is more stressful. But really, life is more stressful for almost everybody during this pandemic. Joey.
Governor, I wanted to ask about testing turnaround time for school districts. I see that you're taking $3 million towards increasing that turnaround time or making that turnaround time quicker. How long are teachers and staff members and students going to have to wait to get their test results back? And how is this $3 million going to help?
Well, I will give you the worst answer is it depends. It depends upon where they are. It depends upon what the national labs do. The $3 million is actually going out to pharmacies, which will be more in rural Idaho. We know we're going to increase the capacity at the lab that Director Jepson administers right down the street here about 20 blocks. We know we're going to have more capacity there. There's a lot of capacity coming on everywhere, and hopefully the national labs where a lot of our samples in Idaho go out, they're going to get caught up. They're actually more caught up now than they were a little bit ago. And the other thing is we've got point-of-care machines going into all 400 of, is it all 400 of our long-term care facilities? 82 of our long-term care facilities. That's going to relieve demand on some of our other areas. The Veterans Hospital up here is taking care of my corrections problems. So we're at 20,000 tests a week, and we're going to ramp that up. But it's not going to be perfect everywhere. We have what the testing task force alludes to as testing deserts. It's communities that are a long way, and part of that money, both those two different groups, because it's $21 million to test school staff, is going to increase capacity out there. Is it going to be perfect? I'll guarantee it's not, but it's going to be a lot better than it is now.
And then, what would you like to see the turnaround time be for teachers and students and staff to get their test results?
Well, of course, if it's point of care, I'd like to see it be 15 minutes. But we think 2 days. Is that
2 to 3 days? 2
to 3 days. Yes.
Governor, CBS 2 Scott Logan is asking 3 questions on the economy. First, how would
3 questions, Scott. Go ahead.
There we go. How would you characterize the processing of unemployment claims now as compared to 3 months ago?
Logarithmically better.
In what? Can you explain?
Well, we basically, other than the normal backlog, the backlog's gone away. But maybe I can answer his second question, so he'll only have 2. We know there's a new federal program. We believe there's a new federal program, and the lessons that we learned from our first unemployment debacle, I'll be honest about it, the fact that we just didn't have the capacity, we didn't have the way to modify the software. We want to be prepared if Congress does what they're talking about doing is saying we're going to pay 70% of your income. If that's a problem in Idaho, it's a bigger problem in other states. I was just on a national governor's call yesterday, and all the governors are saying, we're just barely getting ahead of the problem we had before. Don't give us a new problem. But Congress, rightfully so, wants to address the crisis out there. But we're way better prepared. You know, we know how now to flip on the switch, to have a call center to alleviate that. We've got more people trained. We got a lot more capacity.
Can you talk about your thoughts on the back to work bonus program, how that's going? And I think it's supposed to end this month, the end of this month.
It is, and of course we put that program in. My Coronavirus Financial Advisory Committee recommended that program to us to kind of make up for the unintended consequences of the $600 payment that was out there. That there were people that both employers and employees that say, our business is a little slow, I'd like to have you come back to work, but if I get this back to work bonus, I'll call you back to work, because we want people in Idaho to be gainfully employed for a lot of reasons. It's the right thing to do. So we didn't have the subscription rate on that that we originally anticipated. Matter of fact, yesterday I made a little modification to it because our start date was, I can't even remember what the date was, but some of those employers called people back 2 or 3 days earlier to do the cleanup, and it was unfair to them. So I think I modified that, or made the recommendation we modify it the other day. But almost every time we start one of these programs, whether it was the grants to small businesses or individuals, the federal government changes kind of the rules, and then it's not as necessary. But we're trying to react with our programs to make sure that the minimum number of people fall through the gap of the negative consequences of the pandemic. Yes, Betsy.
Help a neighbor in need, spruce up our community, and have a chance to win some.
With IACI and with daycare providers and parents from around the state in a call about the situation of their industry, which they say is in crisis. And it appears that daycare operations are failing all across the state because they're paid on the basis of attendance, and the kids aren't attending, the parents are home, and a whole lot of Idaho's daycare businesses, which are rather small businesses, are expected to go out of business. We still have $400 million left unallocated in our $1.25 billion share of the CARES Act money. Have you given any thought to directing any of that toward daycare, given the concerns of businesses and daycares about how to get employees back to work?
Well, they are the daycare facilities. There's whether it's immune compromised, elderly teachers, people that are in the hospitality industry, and I would add daycare, whether they be workers or whether they be owners, are some of the unfair impacts. Yes, I would look at it, but B, we've got programs we haven't got totally subscribed right now. And when I've been on the calls with them, some of them also were awarded grants through the PPP program. So we're trying to get our arms around it. There's some of it. There's still some dollars out there that are unallocated in our existing program. Dave, did I miss anything on that? Okay.
Governor, you got time for
one more question. Yeah.
I wanted to ask also about testing, but not just for teachers and school staff, but what about for the rest of the Idahoans? We've heard from several of them just this week saying that they've had to wait up to 2 weeks just to get their results back. Is anything being done on the state level to help out, turnaround time capacity for the rest of it?
Well, all of these things we're doing on testing, whether it's our state lab, whether it's what we're doing at point of care in long-term care facilities and nursing homes, what we're doing with our prisons, what we're doing with jails, every one of those is a little part of it. A big part of it is what are we doing on PPP? What are we doing for swabs? What are we doing for antigens? We do know that the biggest testing facility here in this valley is changing their vendor to a vendor where they can get more of what they need, the reagents for their machine to work. And so there's there's literally 20 different things happen on testing. None of them as fast as we would like. I think that when's the testing task force meet again? It's quite soon, but we continue to look at their recommendations. But this is a problem everywhere. Every state is having this problem, and too many of us were dependent upon the national labs to facilitate that. So somebody that had to wait 12 or 14 or 16 days, that literally is worthless, because you're already through your period, your infectious period when you find out that you're positive. So those time gaps, I don't think that's the case today. I might be wrong, but what I'm understanding is they're getting more caught up because there's more capacity going into it. But as the pandemic exploded all over the United States, the capacity problem exploded with it. We test more people in this country than any country in the world. And then one of the other issues that's out there is there's new testing procedures, much cheaper, maybe not as accurate, that are kind of in the queue. And if some of those show up, people that invested a lot of money in testing capacity are worried about their investment. So that's part of the reason that hospitals, private firms, pharmacies have not, and we're urging them to do all they can. But if the antigen testing gets as widely available as it is, we'll be able to handle this testing thing. But right now, it's all hands on deck to do all we can to get adequate testing here in Idaho. And a lot of states have got testing capacity today that's not being used. Their rates going down. So we'll probably be beneficiaries of that. Thank you all very much.
Governor Brad Little wrapping up his 1 hour long news conference today, talking about the latest on the situation on the coronavirus here in Idaho, as far as reopening plan goes, as far as back to school goes as well. The governor announced that we will be staying in stage 4 of the reopening plan for at least another 2 weeks. That would make it a total of 8 weeks staying in stage 4 of reopening. A large part of the focus today was about back to school issues. And the governor said that if kids are out of school for too long, it hurts their learning. State Superintendent of Public Instruction Sherry Ibarra echoed that sentiment, saying that the kids will suffer if they're not in school and have to learn from home for too long of a period of time. But she's also saying a priority, of course, is the health and safety of the teachers, staff, and students. The governor said the expectation is that schools will not be closed for extended periods of time because the situations around the state are so varied. A lot of spread in one area, many cases in some areas like the Treasure Valley, but in some areas there are no cases or very low positivity rates. The governor outlined what the state's been doing to try to open schools safely, and that is basically pumping a lot of money into that situation, including $10 million for personal protective equipment, including masks, gloves, hand sanitizer, plexiglass for schools all over the state, $48 million for bridging the digital divide. That's providing devices like computers, tablets for kids, also internet activity for those kids who don't have access to that right now. $21 million for testing of teachers and staff. Also $3 million for testing lab turnaround times, improving that, and for additional testing. And $3 million to leverage pharmacies for testing in the more rural areas of Idaho. Also, when asked by our Joey Practical about the turnaround time if a teacher or a student has to get tested, the governor said that it looks like the expectation is that it would be 2 to 3 days for them to get those tests back. So a disruption if a teacher can't be in class, but they're saying maybe 2 to 3 days. And so that is the big news that has come out of this news conference today. We had Joe Paris and Joey Practical there for us today covering this story. So we will have a complete wrap up for you coming up today on the news at 4 and 5 and I'm sure 6 and 10 as well as on KTVB.com. Thanks for watching this afternoon. We'll now return you to your regular programming.
The Hourglass.